Welcome to today's edition of True North Tuesdays. Please be sure to share this with your friends and family and to like us on all social media platforms. Buzzing all the bells out the box. I just hit a lick with the box. Had to put the stick in the box. Pour up the whole damn seal. I'ma get lazy. I got the mojo deals. We been trapping like the 80s. Hi there, True Northers, and welcome back to another episode of True North Tuesday. Now, a lot of things have been happening, from the increasing number of COVID cases to gender-based violence, and not to mention that it's been quite chilly, so I really hope you're keeping warm at home. Today we'll be discussing PMS, and I know that term is thrown around loosely, and some people may know what PMS is and others may not know what PMS is. So what is PMS? PMS is what's known as premenstrual syndrome or premenstrual dysphoric disorder. It happens a week before your menstruation and then ends with the end of menstruation. So it starts at the start of the luteal phase and then ends with menstruation. And a lot of women may have the symptoms of PMS, but it may not fit the diagnostic criteria to be diagnosed with PMS. And how is the diagnosis of PMS done? So PMS is a cluster of symptoms, and the patient must have 5 or more of the symptoms to be diagnosed with PMS. And those symptoms include your mood swings, irritability, being anxious, depressed, migraine headaches, breast tenderness, bloatedness, joint and muscle pains, and also weight gain. So if you go and consult and you have those symptoms, your doctor may diagnose you with PMS, especially if those symptoms happen a week before your menstruation and then end with the end of menstruation. What is the cause of PMS and why do women go through PMS? So the general cause for PMS is not known, but it is speculated, and there are theories that the cyclical changes of our hormones is what causes PMS, and that's your estrogen and your progesterone. And then there's also genetics that play a role, that they may say because of genetics then you are prone to having PMS. How does one treat PMS? So the first line treatment for PMS will be your low dose SSRIs, and that's your antidepressants. But before we get to your SSRIs and your antidepressants, we want to have lifestyle modifications, because it may affect your work life. So you want to improve your symptoms by taking calcium supplements, exercising more regularly, taking vitamin C. Magnesium has also been proven to improve the mood during PMS. So if you take some of those supplements, it may improve your PMS symptoms. Then we'll go to the drug treatment of PMS, and that would be your oral contraceptives, because we're suppressing ovulation, so decreasing the estrogen, and that's how it improves PMS symptoms, your contraceptives. And then your SSRIs, which are your antidepressants, is what then would help to improve your mood, and the doctor would be able to prescribe one of the antidepressants for you to manage PMS. But remember, for us to have a diagnosis, you must at least keep a diary of your symptoms a week before your period and even towards the end of your period. Then we'll be able to help to diagnose you correctly, because there are a number of differential diagnoses. So you must please make a booking with your gynae and have that sorted out. And that's a summary of PMS, and I hope you understand. But if you have any questions, please drop us a DM, send us a message, text us, call us, and make a booking with us on True North OBGYN. See you next time. I just hit a lick with the box, had to put the stick in the box. Pour up the whole damn seal, I'ma get lazy.